Okay. Since they mentioned dapat to include the distal radius fracture, the Coles fracture and your Smith fracture is all part of your distal radius fracture. So with the distal radius fracture, actually dua. No? We have your Coles fracture and your Smith fracture. For Coles fracture, this is a fracture of your distal radius. Same with the Smith fracture. Same yapon, fracture of your distal radius. The difference is that when I talk about Coles fracture, the displacement of wrist is posteriorly compared to Smith fracture that the displacement of wrist anteriorly. So, the mechanism of injury of your Coles fracture, no, the etiology is whoosh, fall onto an outstretched hand with wrist extension. So, doon amo lang gini siya. Amo lang eh. That's why, the displacement of your wrist nag-go siya posteriorly. Diba? Nagpa-posterior, kaya naka-wrist extension. On the other hand, kay Smith is fuboth. Familiar with fuboth? Flex onto the back of your hand. So, doon naka wrist flexion. So, if naka-amune, the displacement will go anteriorly. That's why the displacement of your wrist goes anteriorly. Okay? From push to fuboth. Okay? So, the manifestation, if you see, one of the important manifestation or clinical manifestation of your Coles fracture is your dinner fork deformity. On the other hand, Smith fracture, important clinical manifestation is your garden spade deformity. Okay? Here, as you can see in the picture, si Coles fracture, nagkadto siya posteriorly. Okay? Your distal radius goes posteriorly. Your Smith naman, your distal radius goes anteriorly. Si radius, ang ginalan to guys ha? Okay? Sige. Here, this is a picture of your dinner fork deformity. Okay? Why you say garden spade? Here's a dinner fork deformity. Dito nagkanto siya ya panao. Doon nag-step deformity siya kuno abe. Like, this one and then balik naman siya. Okay? Doon lagi siya ganiya. Ada lagi siya. Doon naging tawag sa atin sa amo niyo?
Kutsara.
Kutsara. Tinidor.
Tinidor.
Sige. No seaman pa. Ano to sa mga 15? Hindi 4. Ano sila gets? Ano sila gets?
Ha?
No same thoughts. Nag-ask ko gina.
Ano man?
Pilata do ka amo na ta subong. Nagsabat siya. Aba ko 15 ta subong. Aba ko nag-ask ko 15 ta subong. Nagsabat siya 4. Ay ginamin ko yung 15 students. Siya day. Same man sa imo.
Okay.
Kutsara niyo.
May kaliwa ba sa right? May kaliwa ba sa right?
Again, guys, ay yung ilang mechanism of injury. Ang Coles fracture, naka-amon eh. Si Smith fracture, naka-amon eh. Okay, ano yung picture? Si Coles are, si Smith are. Okay? Sige. Coles fracture is the most common fracture of your distal radius compared kay Smith nga less common. Okay? Though both of them are part of the distal radius fracture, but the most common is Coles fracture. With the clinical manifestation of your Coles fracture, sudden wrist pain, knowing this is a fracture, it can happen suddenly. Swelling and tenderness over your distal radius, especially more on posteriorly. And limited wrist range of motion, flexion extension, radial and ulnar deviation, and pain with gripping movement. On the other hand, kay Smith fracture, the clinical manifestation is also kind of the same. Severe wrist pain since fracture is a sudden injury, swelling and tenderness over your distal radius, specifically anteriorly, your limited wrist range of motion, your flexion range of motion, extension, ulnar, and radial deviation, and decreased grip strength. Complications, malunion, and of course, your carpal tunnel syndrome. Since, again, distal radius fracture, the contents there might affect your median nerve, which is inside of your carpal tunnel. Okay? What's the contents inside of your carpal tunnel? Again?
4 FPS, 4 FPL,
4 FDS, 4 FDP,
1 FPL,
1 FPL, 1 median nerve. Bilis na tanan.
9, 3, 6, 7,
4, 4, 1, 1. 10.
10,
9 ka tendons, 1 ka nerve. Okay, perfect. Sige. I only included also a common fracture of your forearm. Pero hindi na siya included sa hindi na siya included sa oral revalida. But you can use this one, differential diagnosis lang, of your distal radius. We have here si Coles and si Smith. So you can just add for differential diagnosis. Monteglia fracture, this one gina-discuss mo siya gapon sa review center, so i-advance na lang. Monteglia fracture, there is a fracture of your ulna. So na-fracture kinagal si ulna kag na-dislocate si radius. This is Monteglia. Si Galeazzi fracture, na-fracture si radius but na-dislocate si ulna. So they're opposite na sila nga duwa. Okay? Mager. No? Monteglia, fracture, ulna. Galeazzi, fracture, radius. And then, ang dislocation na lang ang opposite. Basta both of the radius and ulna are affected. No, it could be fractured siya or dislocated. Okay? Goods na with the mager. You can use this to DDX the pulse fracture and your Smith fracture.
Nga dislocation.
Ano dislocation?
Dislocation.
Sige lang guys, ano po? Not dislocation. Actually, dislocation. Yung copy-paste ko lang nabigaging change na son ang una kang radius. Kaya type ko din sila maduwa. Dislocation dyan. Wala ko sige na isa-isa. Pinaka-copy-paste ko sila kagin na kung same naman. Kita na nibing contents. Yung research ko. Yung from the book, from Maggie, from Sullivan. So,
Na-disblock.
na-disblock siya guys. Any questions? Premo lang niya siya, here, no? Kay Monteglia, na-fracture si radius, na-dislocate si ulna. Si Galeazzi, no, na-fracture si radius, na-dislocate si ulna. Okay, this one is included in your oral revalida, which is your scaphoid fracture. Knowing that the most common fractured of your carpal bones is your scaphoid. How about the most common dislocated carpal bone? Lunate. No? Dislunate? Perfect. Scaphoid fracture, fracture of the scaphoid, a carpal bone. How many carpal bones do we have? 8? 9. 8. Guys, 8 carpal bones and 7 tarsal bones. Amo na siya. So, the etiology, usually, push man yapon, no? Fall onto an outstretched hand with the wrist in hyperextension. Sino yapon, doka amo ni siya. Okay? This is usually related with the sports injuries or direct trauma into your scaphoid bone. Pathophysiology, axial force through the extended wrist fractures of the scaphoid or force lang or trauma, and then proximal fractures are at risk for a vascular necrosis because of limited blood supply. Knowing that si scaphoid fracture, si scaphoid bone has a limited blood supply. Okay, same with the supraspinatus. A vascular necrosis there is a decrease or absent blood supply of that structure. Okay? Clinical manifestation, we have here pain at the radial side of the wrist, knowing that your scaphoid located radially, diba, or laterally. Anatomical snapback tenderness, here. Your swelling around the wrist, pain with gripping and pinching, and decrease ROM of your wrist, especially your flexion extension, radial and ulnar deviation, and pain with the axial compression of your thumb. Complications of vascular necrosis, knowing again with the blood supply, decreased scaphoid, and non-union, malunion, or delayed union. Non-union, why naging siya nag-heal? No? Malunion is incorrect, and delayed is na delayed lang ang ossifications of your bone. Okay? Your special test, we have here your scaphoid compression test, or the axial thumb compression. So basically, i-compress naman si scaphoid. The positive sign is pain over the scaphoid and indication of your scaphoid fracture. But usually guys, we're not performing special tests na if we know that the condition of the patient is a fracture. Okay? An important thing to diagnose a fracture is what? X-ray. Diagnostic test, X-ray. Pero though usually, may binaritten siya sa book na may special test in a fracture, but as a suspected fracture, but if the patient is diagnosed with a fracture, you don't need to perform special test at all. Kaya nga, sakit-sakit na guys, no, di ba? I-compress nyo na fracture sa scaphoid, yung compress nyo pag that's a big no, okay? The very common and the favorite of all, carpal tunnel syndrome, your CTS. This is the compression of your or entrapment of your median nerve inside of your carpal tunnel. So usually develops gradually due to the increased pressure of your tunnel. Etiology or epidemiology, most common entrapment, neuropathy. Yeah, this is the most common entrapment can see carpal tunnel syndrome. Even if mag-duty ka mo with the other clinics, usually encounter with ka mo with the CTS. Most common in women over men, usually in 40 to 60 years old, it's because of what?
Pregnancy.
Pregnancy. Yeah, but guys, most common siya sa women than men, it's because of the pregnancy. Okay, wala to sa age. Nag-mix na, wala sa age. Will frequently affects the dominant hand but may become bilateral. Especially if pregnant ang patient, usually bilateral. But if unilateral, if common dominant, it's because of the hand functions, usually gripping, something, yung mga activities, correlating with the etiology. Anything that decreases the size of your carpal tunnel may lead to the compression of your median nerve. So, everything na mag-decrease ang size because of the increase of pressure, it may cause median nerve entrapment. Maybe because of the flexor tendon inflammation, synovial hypertrophy, no? Wrist trauma or direct trauma to the wrist, or even edema during pregnant women, in a pregnant woman. So clinical manifestation, natunga siya into two. We have your sensory symptoms and your motor symptoms. Sensory, of course, numbness sensation, tingling sensation, radiating pain, burning sensation. Obviously, to what? Your median nerve distribution. Usually the lateral, 1, 2, 3, and the half of your
Ring finger.
Rang, cover. Anyway. Wala lang. Sige guys. It occurs in the thumb, your index finger, your middle finger, and the radial half of your ring finger, or your lateral half of your ring finger. This is sensory in nature. But motor in symptoms, we have weak grip strength, difficulty pinching objects, knowing with the functions of your thumb, frequent dropping of the objects, and clumsiness. Advanced stages, there will be thenar muscle weakness or retinal muscle atrophy. Okay? The advanced causes is kind of a complication na. Okay? Complications, permanent median nerve damage. Obviously, there will be permanent problem with the sensation and strength. The thenar muscle atrophy, loss of thumb opposition, knowing in opposition, a muscle is supplied by the median nerve. Decreased grip and pinch strength, functional disability, and your chronic pain. Differential diagnosis, here. Yung nag-give na ko differential diagnosis because this is the only one nag-include nila na kind of neurological in nature. Majority is musculoskeletal, CPS. What do you think? Cervical radiculopathy. specifically C7, C6 to C7. Amo na yung dapat ako. Cervical radiculopathy. Median nerve. Median nerve is a branch. Di ba? From C5 to T1. But cervical radiculopathy, it's because the distribution C6, C7, C6, C7, di ba? C6, C7. Yes, in nature. Cervical radiculopathy. Di ba radiculopathy? It could be problem with the sensation or with the weakness. Now there is radiating pain, numbness. So this is C6, di ba? Your thumb. C7 is your middle finger. So maybe you can just correlate it with your carpal tunnel syndrome. Differentiate lang. But with the cervical radiculopathy, it's more on the numbness is from the cervical area, radiating into the C6 to C7 distribution. Prenatal teres syndrome, as what you have said, prenatal teres syndrome, the affectation is more proximal, not the more proximal. Your anterior interosseous nerve syndrome, what is that? AIN, of course. It's the manifestation. How about the manifestation? It's more on weakness, no? Pinch test. This is to rule in the anterior interosseous nerve. Okay, it's because the muscles are affected. Okay, this is purely motor symptom. CAIN. Peripheral neuropathy or diabetic neuropathy and thoracic outlet syndrome. These are like common or general that you can correlate or differentiate into your carpal tunnel syndrome. Okay? As long as you can defend, go for it. Okay? This is not limited conditions. Special tests of your carpal tunnel syndrome. We have your carpal compression test or your Dorcans test. Yes. Your tinal sign. We have your tinal signs of your elbow. Diba? This is for ulnar nerve and here for your carpal tunnel. Phalanx test. Anong phalanx? Very good. That's the phalanx. This is the reverse phalanx. No? And hand elevation test. Okay? So usually, flick sign. Wala akong nag-include. Kaya muna na nakita ko kay Magalang. Preparado sa flick sign. Kasi flick sign. Kung gina siya karoon dito, diba? Pero guys, the most important or the most, okay, the standard, no, the standard test for the CTS, usually your carpal compression test because this is direct. No, the most common is your phalanx. Okay, the standard usually your carpal compression. The most common si phalanx. Okay, gold standard diagnostic test is your EMG NCV or NCS. Nerve conduction velocity test or nerve conduction studies with EMG or electromyography. So, with the medical assessment, dapat i-mention mo ni si gold standard nga NCV. No, NCV, EMG. EMG, NCV. Okay? This one is very important. Another very common, si DQT. Decurving stenosynovitis. Other name is stenosing tenosynovitis, involving the first dorsal compartment of the wrist. Specifically, flexor compartment or extensor compartment? Extensor compartment. Specifically, your extensor tunnel. Extensor tunnel, 1. Di ba we have 6 extensor tunnels? 1, 2, 3, 4, 5, 6. It's because extensor tunnel 1, dila nagagawa si Apollo X Pobre. Si APL kag si EPB. APL, APL, EPB. No, di ba? Because in DQT or decurving stenosynovitis, the inflammation is in your abductor pollicis longus and extensor pollicis brevis. Okay? Epidemiology, one of the most common cause of your radial wrist pain, knowing that the affected structures are all radially located. More common in women than in men, between 30 to 50, amo ni siya galing 30 to 50, frequently affects your dominant hand. Here, the clinical manifestation, this is gradual onset, gradual. Because inflammation and thickening does not happen in just one night. In your radial styloid process, specifically the thumb side of your wrist, Raise with thumb movement, especially gripping or pinching. Localized swelling over your radial or wrist, no? Thickened tendon may be palpable with weak grip strength. Complications, very, very common, chronic pain. Nakuha niya ganda mo? Sige na lang, tuloy na lang. Persistent inflammation, it's because it's why leading to thickened tendon or sheath, reduced thumb range of motion or even no thumb range of motion, weak grip and pinch strength, functional disability kag tendon degeneration, knowing that the affected structures are all purely tendons. Okay? Okay. Sa etiology, no? Harap pa sa etiology sa likod, sa punta. Sorry lang. Etiology, this is usually repetitive, no? Friction of your Apollo X vertebrae, your abductor palliatus longus, extensor palliatus brevis, which is the first compartment, extensor compartment. Thickening of your tendon narrows the compartment, leading to the restricting movement of these tendons mentioned. Wrist fractures, usually with the repetitive thumb motions or repetitive gripping or pinching. Pregnancy, rheumatoid arthritis, and direct trauma with occupational overuse. Special tests. Finkelstein, this is the classic test, and your Eckhoff's test.
Paano na siya? Paano na si Eiko? Paano siya perform?
Secret. Secret. Si Finkelstein, paano si Finkelstein? Actively, and then ulnar nerve, active, passive.
Active.
Passive. Actively si patient, pero si examiner ma-passive.
All of the above dapat.
Si Eckhoff test is that si patient active and then siya tanan. Okay?
Mula man nagaling kinala.
Yes.
Secret.
Siguro sakit din ako, no?
Positive.
Positive na.
Sakit ko.
Okay, we're done with your DQT. Another is Dupuytren's range contracture. Dupuytren's contractures. This is a progressive fibrocartilaginous disorder, usually affecting your palmar fascia. Thickening and shortening of the fascia leading to flexion contractures of your fingers. So usually it happens in the ulnar side of the hand naman. No, diba? If mga problems so kagina kay scaphoid fracture, kay DQT, it's all lateral. The medial na problem is your Dupuytren contracture because it affects usually your ring finger and your little finger. No? It involves additional with your palmar aponeurosis or palmar fascia. Dupuytren contractures etiology, usually the exact cause is idiopathic. Ano to ganun yung mga idiopathic in nature? ADCAP.
Kapatanan?
Sa ako na di Batman. And your Dupuytren contracture. No, usually guys, it happens in males and usually for more than 40 years of age. Often bilateral, not be asymmetrical, slowly progressive over years. So this one is a slowly progressive. It does not happen overnight, okay? With the pathophysiology, the fibroblast proliferations within the palmar fascia, the formation of the collagen-rich nodules, diba, there's a presence of nodules, the Dupuytren contracture. The nodules develop into a fibrous cords leading to progressive shortening of your fascia, making it to have a more or permanent flexion deformity, like this one, like in the picture. Okay? This one. Ano na ganit nga sign? This is okay. This is can be seen in median nerve.
Median nerve.
Depende. Yes, this is ulnar.
Depende siya sir kung paano mo siya ipa-perform. Kung close, kung mapabilin siya mo ni median.
Okay. Okay, no problem with that. Okay, So, with the clinical manifestations, we have here, since this is a slowly progressive disease, we have your early stage and your progressive stage and your late stage. Your early stage, usually small, painless nodules lang in the palm, specifically in the middle side of your palm, thickening skin, palmar dimpling, and your mild tenderness. With the progressive stage, obviously there will be thick fibrous cords develop, inability to fully extend your fingers, and progressive finger flexion contracture. And last stage, there will be fixed flexion deformity. This is a kind of the last stage of your Dupuytren's contracture. Lastly, your trigger.
Sir, wala ka naman matiyan.
Trigger finger. Ano na lang si...
Singaporean teacher.
Trigger finger is a stenosing tenosynovitis of your flexor tendon, wherein inflammation and thickening of the tendon happens in your A1 pulley. So usually, here, the clinical manifestations, pain at the base of the affected finger of the thumb, over the metacarpophalangeal joint, burst in the morning, clicking and snapping during the finger movement, and catching sensation during flexion or extension. Finger locks in a flexed position and may require passive assistance to straighten, and complications, persistent finger locking, flexion contracture, chronic pain, and permanent loss of motion if untreated. Ginasig-lasig ko na ganyan. Para matapos na ta. Gani, ginasig-lasig ko. Kaya na. Last one, you have your thumb. Osteoarthritis. Is that osteo? Yeah. The CMC. Metacarpophalangeal joint osteoarthritis. Why? It's because they included the thumb CMC osteoarthritis because this is the most common affected joint in osteoarthritis. See? Metacarpophalangeal nga joint. The carpometacarpal joint. It is a degenerative joint disease affecting your first carpometacarpal joint at the base of the thumb. Epidemiology, the most common form of hand osteoarthritis. Damo-damo kita hand osteoarthritis, di ba? It includes your swan neck and boutonniere deformity. But the most common affected nga joint is your carpometacarpal. That's why they included here in the oral revalida. More common in women, especially in 40 to 50 years of age, and increases incidence with relating to your age. Etiology, since this is osteoarthritis, maybe this is degenerative in nature, no wear and tear in nature. So age-related degeneration, repetitive thumb use, previous trauma or fracture, and female sex. Especially postmenopausal. Okay? Check ito. We can go back to the hormonal changes occurring after. The clinical manifestation is that there is pain at the base of the thumb, specifically where your carpometacarpal joint located. Pain with pinching or gripping. Morning stiffness. This one, morning stiffness, this is common. Guys,
30 minutes.
what makes you... Sino 30 minutes?
Si Osteo.
Osteo. If more than 30 minutes,
RH.
But it's not just 30 minutes. Sa other sources, naghahambal 1 minute. Okay? If less than 1 minute, osteo. If more than 1 minute, RA. Depende sa book ang ginawa nila. Progressive thumb deformity in advanced stages. What deformity naman ang you can see? Zigzag deformity. Ano pa?
Hindi ko RA na zigzag.
Could be RAOA. Sino pa? May duwa na siya, guys.
Si Swan Neck.
Si swan neck kag si boutonniere is can be seen in your RA lang din siya. Sino? Si?
Ansel Feliz. Hindi na alam.
Pasal abot. Wow. Sino ganin man ang duwa naman ka nodules man? Evidence.
Okay. Si Bouchard.
Si Bouchard. Bouchard is more proximal, however than si distal. So,
Super deep.
Yes,
No.
problem. Grabe. Ang big si Bouchard, na tingnan ko Bouchard, B, una siya, so proximal siya. H, distal, uli siya. Diba? So, amo na muna. Pero amo na siya, related si Bouchard, because evidence usually with osteoarthritis, and then rheumatoid si Swanek and Boutonniere. And then the other deformities can be seen both, okay? It depends on the conditions or the complications of that specific condition. CMC, your carpometacarpal grind test. So there will be axial compression lang of your metacarpal into the trapezium. So positive test if the patient may feel any pain lang man siya gyapon. Grind test lang, grind test, especially osteoarthritis lang. This is to elicit the pain. Axial compression lang, your CMC joint here, if maka-palpate mo siya.
Ano mo ma-feel, sir? Medyo crunchy.
Huh?
Or crunchy mo ma-feel. Sakit.
If the patient can say painful, then possibly, ano naman siya. It doesn't mean, usually if sa mga arthritis, diba, there is a bump sensations that you can feel. Diba? Like, diba, ma-feel yun na, especially sa knee osteoarthritis.
May crepitus.
May creeping, may sound, ginaya nga doon ka bubble shish na siya, something. Like doon ka grinding something. Doon ma-feel nyo na siya, eventually. Pero here sa CMC grind test, the patients may experience pain sa where area are you locating or palpating or giving axial compression. Differential diagnosis. We're actually almost done. With the differential diagnosis, we have your wrist cartilaginous disc, no? Problem with your wrist at the same time, degenerative osteoarthritis. Anyway, by that siya. Guys, for your differential diagnosis, this one, pwede na sila kaduwa ha. Sila na duwa maaway. Or if you're an si Montegya, kag si Galeazzi. CTS, amo to na pang-mention earlier. Si DQT, pwede mo man di maano sa CTS since they're, I don't know. Si DQT, kag si, sa taga man, pwede mo man din ma-add si DQT dire. Since distal radius fracture, radial, the pain can be seen radially. Same with the DQT, the pain can be seen radial or proximal to the wrist joint. Okay? With the Dupuytren contracture, ano man differential diagnosis sa Dupuytren? Thickening, formal fascia. Pwede si ulnar nerve problem or your median nerve affectation, knowing that the sign manifested, di ba, can be seen in both. Okay? It depends. Since this is the deformity, gini contracture, giniya guys, the difference lang is that this is the contracture of the flexor tendon. The both manifestations of this one, of the median nerve and the ulnar nerve, is more on neurological or nerve affectation. Okay? Trigger finger, you can opt here na lang kanay malit na lang siguro, no? Sila ni Swanek kasi Boutonniere deformity. Actually guys, before, doon gina-compare niya sila apat. Di dyan mo, trigger, mallet finger,
Boutonniere.
Boutonniere, Swanek. Doon sila gini, I don't know, galing na kay last time, ayaw pa niya sila. But they changed in Caucas lang. Very common, goro. Very common si Swanek deformity kasi Boutonniere deformity. Like, I think makita na sila sa sa osteoarthritis na lang ang topic or sa rheumatoid nga discussion. And then your carpometacarpal joint problem, you can opt here na lang rheumatoid arthritis or any arthritis of your hand. Okay?
DQT.
Dire. Thumb, pwede si DQT. Here. Since the pain, but here is more on degenerative changes. Here, tendon problem. Sweater finger, pwede man siya with the trigger finger. Sweater or jersey finger, right?
Yeah.
Other name?
Mag-close.
Question, with the differential diagnosis, ano?
Sweater finger.
Wow. What's the special test?
Carlos.
Then, may tawag siya, di ba? Ano siyang tawag?
Sweater finger.
Sweater sign.
Jersey sign.
Jersey sign. Your medical assessment and your medical management. For your medical assessment, always go back ng Japon
Sulit na. Okay na.
And medical management. Manda ka mo dapat. Pag-oral valida, manda ka mo.
Oh, paano ka?
Ikaw pa.
Who knows? X-ray,
Si Doc Elmore, paano yun?
X-ray, ultrasound, CT scan, and MRI. Same ang yapon. X-ray, usually used for first line, no? If may fractures, especially kay here, kay Coles, kay Smith. Yes. Okay? Kay Montegya, kay Mager. MRI provides cross-sectional images if they cannot read. Usually kay kay Dupoy's ring, kay trigger finger. Okay? Your CT scan, cross-sectional, if you cannot read or if the X-ray cannot read properly the fracture, you can opt for the CT scan. And we added here the electrodiagnostic studies, which is EMG and CV, for your what? Nerve carpal tunnel affectation. Okay? Or nerve affectation. Conservative, I don't have any problem with that. Same naman sa gyapon. Surgical management, fracture reduction or ORIF, open reduction, internal fixation lang. With if you need to check for if you need to the fracture. The tendon or ligament repair or reconstruction, nerve decompression, especially with your carpal tunnel syndrome. The tendon sheath or mga trigger finger or trigger veins, and joint reconstruction or arthroplasty of your CMC if you want to treat the CMC joint. Okay?
Pwede siya.
The may reporter na din. Do you have any other questions?
Lunch.
PT assessment and PT management.
Tapos na yan. Salamat.
Salamat.
PT assessment and your PT management. PT management. How about your PT assessment? What can we check?
I'm sorry.
Sensory, especially if it's CTS.
Yes.
Ano pa? Ocular inspection. For the ocular inspection, especially the deformities given, no? Din ka makita si dinner fork deformity?
Coldies.
Your garden spade deformity?
Smiths. Gardener Smith.
Yes.
Nayabag.
Ano pa? Ano pa nga deformity?
Doon mo naman ang...
Flexion contractures.
Na...
Dopoid trend contractures. And
Your
that's
thumb
it.
CMC joint RA.
Hindi siya medyo. Ocular inspection, palpation,
Range of motion.
range of motion, MMT,
And PRS.
ano pa? Let it, MGM, MP, muscle bulk test if may atrophy, di ba? Ano pa?
Doon mo naman ang garo.
Ano? Limb girth, this is purely for swelling. Muscle bulk test, this is purely for atrophy or muscle. Same lang sila. Usually, if limb girth distal,
Figure of 8.
figure of 8, but here, which ilocate ko
Circumference.
medya kung diin gidya ang bulky, no, ang bulky nga areas. Ano pa? Postural, wala naman. Sensory. No, sensory, especially CTS. Just to rule in to rule out a possible sensory problem. Special tests, very important, and your
Pag-afyon.
outcome
Measure.
measure. Okay? Your PTSS, PT management, ano? Tendon lining, very common. We can go back to guys sa acute kag sa return to function ha. Your acute, subacute, or return to function. But the general lang, tendon lining, very common.
Nerve gliding ano? Wala na.
Ha? Stretching,
Pwede man si tendon blocking.
squeeze ball,
Lain si gliding kag si block.
nerve gliding, pwede tendon or nerve gliding, pwede na siya. Yes, no, that's more functional. Actually, there's a lot of exercises that we can provide to the patient, especially if hand problem, kaya pwede na natin palagpatisan ng exercise. No, as long as we can think the exercises that can help the functionality of the patient, then go for it. Okay? Ano pa? Kamu naman pain.
Dynamometer.
But guys, also don't forget the modalities. It's very important part of your PD management.
Sir, may pwede pagali isa sa PT assessment, si dynamometer. Pwede na siya.
Pwede for the
Si grip
grip
strength.
strength. Dali. Yes, guys. If it's heat, paraffin wax bath na. If you want. If heat, go na for paraffin wax bath. Okay? Ano pa? Yung shockwave mo ah. Okay, do you have another questions?
Ultrasound.
Outcome measures. Okay, we have your this is the outcome measures that I can that I found sa kay Maggie. Di ba may mga pictures that the very last of every region they mentioned the outcome measures. Your dash, your SPADI, your quick dash, hand evaluation card, record, Michigan hand outcome questionnaires, American shoulder and elbow surgeon standard. Upper extremity functional index. Do you have any other questions?
None.
Am I clear?
Yes.
Ay, pause
We're
na.
almost done. Sige.
Ay.
But before that, let's review all the conditions that we discussed from the shoulder. Hindi ka na pag-isa-isaon, just give me the names of the condition.
Slap, bang, slap.